Minister, how are you? We need to welcome, Minister. We need to, oh, okay, I think you are on Zoom too. And now we're rolling. How are you?
Good, thank you very much. And thanks a lot for the invitation.
Sure, well, I'm really glad to have you here. I know that you been really on the front lines of this battle in your country as the Minister of Economy and dealing really as part of the cabinet that is taking all the steps to deal with this both on the health side and then the economic side. So what I want to have today is the first time we're doing this, and you're our very first guest. So I'm really glad to have you here. We are dear friends. We went together. We went to grad school together. I haven't wore a shirt on a while, but because I knew you were going to come with a suit, I decided to give you the honor you deserve. So I think what we want to do here is just to have a conversation. We have about an hour. We're going to be taking questions from people in the audience on Twitter and Instagram and Facebook and so on as we go. So, I mean, I think, Minister, the first thing I want to ask you, and of course you're welcome to do the introduction that you would like, but is to tell us a little bit about the situation of the Dominican Republic right now, and what are the biggest challenges you see moving forward?
Sure. Well, first of all, I want to congratulate you, Dany, for organizing this set of meetings or discussions, because I think that there is a lot of things that we need to learn from each other. We need to learn what's going on in other countries, but we also need to have a dialogue between academia and policymaking, because as a new virus and a new challenge, we are every day learning new things about the virus and about how to handle the situation. So thank you very much for organizing. And I'm pretty sure I'm going to be one of your first fans in the next meetings that you might organize. So the situation in the Dominican Republic, we have more than 12,000 cases right now confirmed with PCR tests. We've been dealing with this situation for about 2 months and a half. Our first case, we call it case 0, was an Italian tourist that was in the eastern part of the country. And since then, we've been able to identify around 12,000 cases. Our death rate, we have had about 411 deaths so far, which gives a fatality rate of about 3.4%. This is the situation. Of course, we know that the true numbers, there's no single country that might be sure about the true numbers. We have a test capacity limit. So that's what we know so far. And we have been implementing different policies for flattening the curve. Of course, flattening the curve is a whole different world in developing countries and in developed countries. And that is something that needs to be discussed.
Tell us more about that, because I think that one of the things that in particular you see in the news today, and I think a lot of the people who are watching, they of course get a lot of the version that you see in the US, which is the center of the pandemic today. Europe before had a lot of things, but these are countries that are very different in nature than a developing country, right? So I mean, I'm sure we're gonna go into details, but it doesn't make sense that the same policies that you would apply in a rich country are the same ones that match one in a developing country.
Definitely. So I think that the same advice that we have in development economics of not following the laundry list or the best practices without studying and considering the context. Specific context matters. Just to give you an example, it is not the same to advise quarantine and lockdowns in developed countries such as Spain, Italy, or even the US, where you can say that most of the families, they live in a house with 2 or 3 people with enough space. It's not the same as in the Dominican Republic and other Latin American countries. in which the situation is that you have overcrowded houses. You have houses that in 10 or 20 meters, you have 6, 7, or 8 people living together. It's not the same applying social distancing in each scenario. You cannot separate people in their houses.
Different generations too, right? I mean, you
Well,
have a lot of multi-generation.
That is very important what you mentioned, because for economic reasons, some families, all the members live together. So you have a multi-generational family in which you have very old people, which are the most fragile and vulnerable, living with young people that eventually need to go to work or need to go to school. So differentiating groups in the population is not as easy in developing countries as it might be in developed countries, where you have a lower number of family members per unit.
But this matters for what in particular? Does this matter for how to define the lockdown that countries are setting up? I mean, why is this so important? Because like in rich countries, what you've seen too is, at least until today, is that there has been no differentiation in terms of like the younger folks can go out and work and the older folks are more vulnerable. I mean, everybody's on lockdown. Is that the case too in the Dominican Republic?
Sure, Dany. So we are having an advice from one of your followers that I should use microphone. Let me try this.
Oh, okay. So good. So I can hear perfectly. Yes.
Okay. I hope that we have improved.
Is it better? I don't know who was the kind soul that told us that, but all right. Well,
we hope it's better. Oh, and probably turning off the air conditioner here might work as well. Let's see in Instagram if people think it's better. It's been improved. Okay, people are saying we have improved. So
okay, that's good.
Okay.
So I mean, you were saying, basically, let me just rephrase the question because it was a bit, so you're saying, I mean, the composition of the household in a developing country is very different than the composition of a household in rich countries, because there's basically multi-generational households. There are houses that are larger, and maybe the grandfather and the grandmother lives with the kids. So in that case, it makes it much more difficult, even if you think of it in a scenario of the kid being able to go back to school and reopen the economy, because that kid could also endanger members of his own household in a much higher propensity that you would see in a rich country. Is that what we're getting at?
Yes. So let me put this in context. I think that one of the realities that we have to accept is that we need to learn how to live with COVID-19. It's going to be here for a long time until we get a vaccine and we get everyone vaccinated. So even if you see the serological surveys that have been conducted, for example, in certain parts of the United States and in Spain, we're still only with 10% of the population already infected by COVID-19. What it means is that you still have 90% of the population that is susceptible for getting infected. So the herd immunization that might take place over the time, even flattening the curve, diminishes the number of people infected at the same time, but it doesn't necessarily reduce the number of people that are going to be infected in a period of time. Let's say the integer below the curve. So we need to learn how to live with that. So
right.
And we need to learn how to go to work and earn a salary and eventually go back to school. That is going to be easier in developed countries where you have the older people living alone because they have their own houses and all that. So those vulnerable groups, you can isolate them more easily. And you might recall one paper by a couple of folks in MIT, Darren Asimoglu and all that, and all those folks, and they're recommending an intelligent lockdown in which you identify vulnerable population, you separate them, you don't let them take place in social activities and labor activities, but you have the rest of the economy working. It doesn't work in developing countries because all of them are living together. So if you get infected either at work or any other place, you're going to infect people in your house, and you're going to infect the vulnerable population in your residence, because we have this phenomenon of the multi-generational family households.
Right. So what does that mean? That's terrible news, basically, right? Because you're saying, I mean, it makes sense that rich countries could start thinking, mayors or governors, or because this is a very localized geographic area. I mean, most countries are bigger than the Dominican Republic. So, I mean, you in particular do have to think about the country as a whole. But, I mean, this means that in rich countries, you could start thinking about ways to release these lockdowns or to ease the stay-at-home orders and protect the vulnerable, and maybe, have them stay at home for longer or something of that sort. But for you, that's not a possibility at all, right? So how do you think about, restarting, I mean, how to serve this wave? How do you continue live knowing that this pandemic is going to be here for a year or even more?
Well, I think that it brings even more urgency to the health sector in developing countries to strengthen enough to be able to give a service early enough to this population. So most probably a high percentage of the population is going to be infected anyway. In developing countries, you cannot choose who's going to be infected and not by isolating because of this phenomenon. So you have an even shorter time span to improve your health sector. Or you could even try certain policies that are controversial, of course. And I say controversial because we don't have enough information about anything fighting COVID-19. But you could be thinking on prophylaxis, for example, giving certain medication to vulnerable groups to make sure that, or at least to try that if they get infected, they are going to recover faster because you reduce the virus amount in their system. We're talking about hydroxychloroquine, we're talking about ivermectin. And of course, an academic as you are might say, well, we don't have enough research in order to be comfortable proposing that, which means that in developing countries, we should be able to try our own research regarding certain medications. Because let me tell you one thing, it's not the same fighting COVID-19 in the Dominican Republic or in Latin America than fighting it in Asia. We might have different viruses. So we need to improve our health system capacity to take care of them, but also to do the necessary research in order to produce evidence so that we can improve our treatment protocols, for example.
Right. So, I mean, well, that's really important. And I think that speaks also about the need to which is an ongoing conversation for many years, of shortening the clock of academic research, while, of course, keeping the rigorosity. But I understand that on the field, you need to make these decisions fast. So we saw in the news actually that there was an announcement last night that the Dominican Republic is reopening.
Yes.
You're starting the reopening. It seems that you are you're in a place in which you feel that the virus has been to some extent contained, which is great news. So I want to talk about the economy, but beforehand, I do want to talk to you about one particular aspect that we've been hearing so much about. Flattening the curve. And the whole idea of flattening the curve, as I understand it, and you are the policymakers, you told me, is to not to overwhelm the health system, right? So I mean, it's almost impossible to stop the spread of infection to zero.
Yes.
But you can significantly reduce it if you have the lockdowns or stay at homes or social distancing and using the masks and all these measures that we are applying. But at the end of the story, what defines whether the curve is flattened enough is the capacity of the hospital system, yes. Right? So it's not only about the curve, it's also about the line above of the curve. You want to keep that line always above the curve. And so two things have been happening at the same time for the policymakers. We talk a lot about flattening the curve, but we don't talk enough about increasing the line above the curve, which is to say that increasing the hospital capacity. So I know that you've been really involved in that in your country. And I mean, I want to ask you about that experience, and I want to ask you in particular from the lens of a developing country, because now basically, how do you increase the capacity? Well, buying ventilators or buying equipment, buying medicines. But we are now in a market where there's scarcity. Basically, there's scarcity for ventilators, and you are competing basically with bigger countries, larger countries, richer countries. So how does that work for a developing country?
Sure. Well, I would start by asking, flattening the curve, what curve? What curve are we talking about? We have seen many graphs in which you see that without any social distancing measure, you would have a very high peak curve at the beginning, which might overcome your health system capacity very shortly, which would be terrible for the country. And that is why many people were recommending, okay, let's flatten the curve. Let's have less amount of infected at the same time. But a couple things. First of all, are we talking about the curve of people infected or the curve of severe and critical cases? Because at the beginning, of course, we didn't have enough information about the virus, and you would assume the percentage that we were dealing with in China, that 50% or so were asymptomatic, and 30% would only have mild symptoms, and then around 15% would have a severe symptoms in which you need to get into the hospital, and only 5% would be critical, and then you would need to get into the intensive care unit. So you were assuming the percentage of people that would go to severe cases or critical cases to be fixed. If you have a fixed percentage, then of course reducing the number of people in severe case or critical case could only be achieved by reducing the number of infected people. But that is not the situation right now. Right now, we have more information on how to reduce the probability of a case turning into severe or turning into critical. So that I would say is the first thing. We need to flatten the curve, but flatten the severe and critical cases curve. And that you can do with appropriate health policies, public health policies. So that would be the first one. The second one, I would say, you correctly mentioned that what you're looking for is not having an amount that would overcrowd your health system. But it is only a time frame for you to improve your health system and be able to handle a higher number of cases. Why? Because lockdowns cannot be implemented forever. It comes at a very high economic cost. It comes at a very high social cost. But let me tell you something, it might come at a very high public health cost as well. Because in developing countries, in the Caribbean or in the tropics, having people at home make them more vulnerable to mosquitoes, for example, dengue, Zika, chikungunya. So just to give an example, in this year, in the Dominican Republic, we've seen 4 times the number of cases compared to last year. And last year was already a very difficult year. So it is not as easy. In the developing countries, you need to reduce the distance between the affected curve, or let's say, reduce the percentage of severe and critical cases, but also improve the capacity of the system to deal with those cases, because otherwise you would need to be in lockdown forever and people would starve to die, or because of the reduction in income, they would stop taking their medicine, for example. Because I would also point out something, you need to consider how is the social security system in each country? It is not the same when you have a universal social security system, such as in Europe, that is financed by taxes, by the public, as in Latin America, that most of the social security systems depend on the labor market. So if you're not hired, you might lose your, say, your access to the social security, your health program, for example. So those are all the particularities that you need to consider in order to find the appropriate policies for each context.
Right. So you're saying how we say sometimes in Spanish that the remedy could be even worse than the disease sometimes, if you're unable to address those difficulties. There are, I mean, I want to go to the economy, but there are a few comments here that I want to bring up. Before we were talking, for instance, about the idea of in rich countries that it might be possible, not always, but it might be possible to implement like smarter lockdowns. But yet, USAL is noticing that indeed in rich countries, a big chunk of I think in the US is 25% or more, 33%, and in Europe, up to 50% of the deaths that you've seen are in nursing homes, in homes for the elderly. So even if you, I mean, these are homes with presumably the people are yes. I think that even if you do these small lockdowns, it's important to say that access to the golden standard of healthcare to the first responders should be there, right? I mean, to be able to test on a daily basis the first responders and give them the equipment is really important, because those things could happen. I just wanted to mention that just to say that it's not as easy also to separate the populations.
Yes. Then can I add on the comment that Usal is sending? It is a very interesting comment because, you know, nobody has such a bad luck that nothing works for them. And one difference between developing countries and some developed countries is the population pyramid. One advantage that we have in developing countries is that we have a younger population, which this virus affects less. That is a challenge in developed countries. For example, in Italy, last time I saw the numbers, the mean age for people who died in northern part of Italy was 81 years. Two-thirds of them suffer from hypertension, for example. So we have that advantage in developing countries that people are younger, but precisely where all people live and where vulnerable people live, that is a challenge. In developed countries, you might have nursing homes or homes for the elderly. That is a benefit because you can take care of them, having certain restrictions to visits and all that. Whereas in here, they are all over the territory living with their family members, so it's a lot more difficult.
Right. No, that's very interesting. So that's another layer of the big differences, and why, you know, you basically, as the Minister of Economy, you have not a lot of examples from the developed world on things that you can just take and apply. You have to really think, which is really difficult in these times. So I want to move to the economy. I'm an economist, you are an economist. And of course, there's a lot of people thinking today. I mean, I think that we don't know a lot about the disease, but we know that we need to start thinking about the next phase. We need to start thinking about how to reopen the economies in ways that is sustainable, knowing that the virus is going to be with us for another year or a year and a half in different waves. And in the developed world, we've seen the devastating numbers, right? The U.S. unemployment rate, it's likely to reach even the levels of 1929 of more than 20%. If it hasn't yet, which, you know, there's a little bit of a delay on how we measure these numbers. There's a lot of difficulties in Europe for firms to continue working, because this is not only a demand shock like it was maybe in previous occasions, where for some reason people have lower their desire to spend, or their ability to spend or desire. This is also a supply shock, right? I mean, a theater can't open. So even if I want to go to the movies, I can't, right? So it's the combination of two things. So in that sense, when we were thinking of reopening, I want you to give us a little bit, what you see, what's your plan? What are the biggest challenges that you see? And how do you plan to navigate this in the next few months and even years?
Well, you correctly mentioned that we are experiencing both a supply and demand shock, which are very different between themselves, but also the appropriate policies require a lot of fiscal spending in times where access to financial market is not as easy because cash is thin. Everyone is looking for money, but there is also an interesting aspect of this, is that it is both a supply and demand shock. It is both an internal demand and external demand shock. It complicates everything. So the demand
explain
shock.
Explain that to the mortals, economist.
Well, sure. I mean, as you say, some people are losing their jobs, therefore they don't want or they can't consume. Companies don't know what's going to happen in the future, so they don't want to invest. So who do you have left? The government and people abroad. People abroad are also in a crisis. We have experienced a reduction in our exports to the United States, to Europe, because they are dealing with their own crisis. So who is left? The government. So by saying this, I mean, it is not the same analyzing the crisis in the 80s, the 90s, that we have different crises in Latin America or Asia, that one country or a couple countries might be in trouble, but the rest of the world was doing okay. Now the entire world is not doing okay. So that is a challenge. Who is left? The government. The government to take care of the demand shock, for example, subsidizing consumption, transferring money so that families can consume, but also taking care of the supply shock, helping companies, helping SMEs to survive for a couple months until we have these lockdowns. So it's very, very difficult because governments need a lot of money, but all the governments in the world are looking for money. So we are competing for everything. We are competing for tests, for medicine, for ventilators, and also for financial resources. So that is very difficult.
Well, no, I just one question to double on that, because what you've seen in countries like the US and Europe, let's say, I mean, these are the countries that usually you will look at when you're trying to learn something maybe about policy from the developed world. You've seen that, as you said, I mean, the only thing that is left is government, right? So government is, in many places, they've been pushing out stimulus packages, right? So it could be either monetary policy or fiscal policy. Monetary policy, of course, is the central bank. Fiscal policy would come from the government. And in some instances, these packages in the US, for instance, it accounts for 10% of the GDP, right? That's a huge number. 10% of the GDP is a huge number. And, it's obvious to think that the developing country doesn't have that fiscal space, what economists call, to just say, all right, we're just going to put out 10% of the GDP, because, I mean, at the end of the story, though, that money is not unlimited. I mean, it's come from taxes, it comes from many things. So, I mean, you can now, I mean, in a regular crisis, you would be able to borrow money, right, and pay later. But now, as you're saying, it's very difficult because everybody wants to borrow the money, right? So a developing country that to begin with, it doesn't have access to the market as openly. I mean, there's variation, but as openly as a rich country, it's struggling in that. So tell us a little bit about that. I mean, how have you put together this program in a way that even if it's limited, it's as effective as possible?
Sure, that's another challenge that we have in developing countries. our access to financial markets. It's easier when you're at the US or in European country that the liquidity that is in the financial sector, they are looking for safety in this kind of crisis. So they would go to you. Whereas when you're in a developing country, not only you are competing for resources, but you yourself are seeing riskier. So you might face a higher interest rate because, of course, it's easier to put your money in the US that you know that eventually will recover than to put your money in a country that you know very little about and you don't know if they're going to recover in 1, 2 years or 10 years. So that is a tough situation. Not to mention that we have certain countries that they don't have access to financial markets. So their only possibility is having multilateral or international financial institutions.
Like the World Bank, the IMF.
And regional development banks, but you know they have limited resources, so they cannot help everyone in the amount that would be necessary. And I want to mention something. When we're talking about the supply shock, we need to consider two things, because I think that the way that you address the supply shock, it is going to determine what kind of recovery you're going to have. First of all, we have a lot of the production capacity that is affected, especially SMEs, because you know that you have production chains. So if one part of the chain fails, then you affect all of the rest of the productive ecosystem. So they are very vulnerable. They cannot survive many months without having enough liquidity. But the financial sector is not used to dealing with those companies. So you need to be very smart on how to help the SMEs survive this period. But also there is something that I fear a lot, and is jobless recovery. What we're seeing right now is that we are allowing companies to reopen with limited number of employees, of course, because you want to keep certain distance between them. But what happens is that companies learn how to produce with a lower number of employees, and they need to lower cost anyhow. So I fear that in the recovery, many companies are going to experience an increase in production that is coming from idle resources such as capital and productivity gains, which might increase the unemployment problem that we see in the countries, which eventually might translate into social problems. So as you can see, it is not as easy implementing lockdowns and have everyone stay at home. And in a couple months, we're going to to allow workers to return to their firms. Be careful, because you are dealing with the present and the future. And also, you know, I always give the same example. As you might expect, the Dominican Republic is very susceptible to what happens in the tourism sector. Tourism is 7% of our GDP, 6.7. That is in value added, but of course, if you take into account all the firms that supply to the tourism sector, the satellite account might go up to 20% of the GDP. So
let's explain this for maybe the non-economists in the crowd, so that they'll understand the importance of this sector for the Dominican Republic. So 7% of everything that the Dominican Republic produces every year is basically the services, direct services for tourism. So everything that can qualify as tourism, like the hotels and
bars,
flights,
restaurants,
exactly. But then you have a whole set of industries around it that also depend indirectly on the tourism, and that could be 20% of the GDP. So like 1/5 of the economy depends on the tourists, basically, that are flowing every year to the Dominican Republic. And that went down to zero, basically, in the past few months.
Yes. So just let me give you an example. Let's say that you are doing your national accounts and you see, oh, what is the value added of these 30 restaurants and these 50 hotels? Okay, that's the percentage of the GDP that comes from, say, tourism. We'll call it here bars, restaurants, and hotels. But let's say the pineapple that a farmer is producing in GDP that goes to agriculture. But in the satellite account, if that pineapple is consumed in hotels, it can be attributed to tourism because its
Right.
production would go to tourism.
Right.
So last time we started this phenomenon a couple of years ago, the indirect effect of tourism was about 20% of the GDP in the country. So, and let's say that you have a couple of farmers that might go bankrupt because of this crisis and the reduction in the demand of the hotels. And so let's say that in about a year, these the tourism sector is open again and is consuming more and more. But if the suppliers went bankrupt, and if they cannot produce, it's not as easy for anyone in the country to start producing pineapples from zero because there is a know-how, there is a a certain network that you need to have in order to be able to produce. So starting that from scratch is not as easy. And also, you might have the entrepreneur who is producing pineapple, but then the employees went to another industry, so he needs or she needs to start recruiting again and training the workers. You might lose a lot of productivity. So that's why I say that saving your productive system, your ecosystem is very important because otherwise recomposing this puzzle is going to be very, very difficult and is going to make the process much slower.
Well, this is just a good time to put in parentheses that all of you listening, you should come and visit the Dominican Republic
Yes.
as soon as this is over. It's a beautiful country, beautiful beaches, beautiful hotels. So you should come if you can.
And very nice people.
And visit this beautiful country and the best people. So, and music. Anyway, we can go on and on and on. So, Minister, so, we've been touching in a few topics here and there. So you were saying, for instance, that for a developing country, it's particularly hard now to go and perhaps get the finance that otherwise you would, like get the credit to borrow money, basically, that otherwise you would easily. Now, in particular, when you need to put that money, I mean, to help the SMEs, they were asking what SMEs are, small and medium enterprises, or to help consumers or to help everybody, right? I want to go in a minute into the particular aspects of your economic plan, but I want to go back to a question we raised before that we didn't get to ask too much, which is, you're not only competing for finance, you're also competing for ventilators. You're also competing for the materials to do the test, because test is a crucial aspect here in combating COVID. So you also, as a small country, have a double curse right now, quote unquote, because on the finance part, it's hard to access these markets, but also you're competing with bigger countries. So tell us about that. I know that you've been really at the front, like you in particular, have been in the front line of bringing and increasing the hospital capacity. So tell us a little bit about that experience, because we don't hear that much about how difficult it is to bring capacity to the hospital system, in particular for a country like yours.
That is a great question, because it's true that we have limited fiscal resources, but sometimes you have the money, but you're not able to use it because you don't have anyone to supply to you. And let me just tell you that any firm has the production capacity for normal times. So the producers of ventilators, they have a forecast that they are going to have a demand of 10,000 ventilators. So they have the amount of employees, the amount of machine, and even the fiscal space to produce that 20,000 forecast that they have. So suddenly COVID-19 comes and their demand is not what they had forecasted, about 10,000. Now it's 1,000,000. It is impossible for them to reallocate all the resources and be able to produce that amount in a short time. So that is true for ventilators, that is true for PCR tests, for antibody tests, for reactives, for machines, for pretty much everything. So you have all the countries competing for these resources, but also you have the countries in which you have the companies not allowing them to export. We have experienced that with a mask, just to give you an example, or respirators, the famous N95. Certain countries have imposed an export restriction because they need to supply their people first. So suddenly everyone is competing for these resources. Not to mention that we have our public procurement laws, which makes everything much slower. So we are in a big difficulty. And you need to be learning all the time. Oh, you cannot get tests from the US or from Europe. Oh, but then the Koreans are very good and they can export that. So I can tell you this, it is a fight that you need to live every day. Each day is a fight on its own. You put in order to buy, and I can tell you real examples, 50,000 reactives for certain tests, and they were supposed to deliver to you in 2 weeks, and you keep waiting for them for months and months, and they say, no, I'm sorry, I haven't been able to produce them. So it's very, very tough. That's why I say that you need to be very creative in how you're going to manage the situation. Not to mention that, you know, tests need FDA or the European community to certify the quality. That takes time. So it's not as easy as people think. I know that in most countries, in the Dominican Republic as well, everyone is asking for more tests, more tests. It's not that easy. And, you know, I talk to them every single day, and each day there is a new excuse. Oh, I'm sorry. Now we failed in China, we failed in the US, there is a problem in the Shanghai airport or anything like that. Because I have to say that the entire ecosystem is affected. Those companies on their own, they are experiencing a reduction in employees. In the case, just to give an example, that some of them get infected. And they have to recruit new employees and they have to train new employees. It is not as easy. We don't have that many flights as we had before, or ships. So I would say that the global production capacity has been affected, and that reduces the ability for countries to quickly increase the health sector capacity.
Right. So, I mean, I thank you for saying this, because I think that that's something we don't hear enough. And I think that it should be really hard to be basically managing, you know, from your office, like the equipment that you would need in the future, and all these disruptions, you know, make it a very hard thing. So I think that I want to ask you a question about, I mean, based on the fact that I think, this is my opinion, but I think that a lot of people would agree that, and I don't think about this about every opinion I have, just on this one, that the gold standard in terms of tests would be really to be able to test everybody every week or every day or every few days, and then be able to target each person who is positive, and then isolate that person and so on. It's not a perfect solution, but it's maybe a very, very advanced solution. And that's a solution that has been advocated by many epidemiologists, of course, but also in the economics sphere. Paul Romer, the Nobel Prize laureate Paul Romer, has been championing that. But that seems not to be very feasible in the short run. I mean, as you said, I mean, we cannot just from one day to another increase, even if we had the money, like increase the supply of this. So what is the second best? What are the metrics that you are looking at and that you've been looking at to decide that, you know, it's now okay, it's now safe to start reopening the economy? What are the metrics that, in the absence of being able to know if every single person is infected or not, what are the metrics that you are looking at?
Well, you know that it's become very popular to say, let's target the basic reproduction number, the RT, that everyone is talking about these days. I would look at different measures. I would look at the hospitalization.
That's the number that,
yes.
Just to clarify, that's a number that that tells you what is the average number of infections that one infected individual will create. Yes. During the lifetime of the infection, right?
Yes.
So for COVID in particular, that number was very high. I mean, if there's no restrictions, that number is, they say, it's about 7, some type of number. As long as that number is higher than 1, the disease keeps spreading. When that number goes below 1, in theory, it means that the disease will on its own.
Yes. Yes. So that number helps you see the curve of infected people and even forecast what's going to happen in the future. I wouldn't look much at that number for a couple of reasons. First of all, it is very, very difficult and comes at a very high price to keep the number lower than 1. Also, you know, in terms of the clinical aspect of this virus, as long as you are safe with mild symptoms and your body is not overreacting and putting in danger your lungs and your heart, it's not a problem, because our body has learned to live and fight and co-live with different viruses and bacteria and all that. So the problem is avoiding that an infected person becomes severely ill and might die. So that's why I think a better metric would be the hospitalization number and the number of people that go to ICUs, because that is where you have your restrictions. Just to give you a thought example, let's say everyone is infected and you can give them a candy and the risk would be 0. You wouldn't care if the entire population gets infected. The problem is that there is a percentage of that population that you don't know what candy to give, you don't know what medicine to prescribe, and might end up using your limited health sector resources. So at the beginning, the percentage was fixed because we didn't know how to handle this situation. But now we don't know everything, of course, but we have certain, we have some information and some evidence on what works. You need to avoid the increase in the inflammatory system and avoid the cytokine storm and all that. So you can handle a higher amount of infected and reduce the number that would go or need a hospital bed or an intensive care unit. So that would be the measures that I would put attention to. And also, I want to mention something that we are having one question from the audience.
Yes.
What I would do different in 2021 than what we are doing in 2020? Well, I think that 2020, the most strategic or the smartest policies would be to strengthen the health sector. I know it's tough, believe me, I know, but improve test capacity, improve tracing, be smart in your test strategy, because you're never going to have all the tests that you need. So you need to be smart in having supply from different companies, not to be very vulnerable if one company fails to deliver to you. So you need to reduce the risk by having different suppliers. You need to use more serological tests, which are easier to find than PCR. You need to prioritize vulnerable groups, or you need to prioritize doing triage in hospitals, or using certain proxies to being infected, such as temperature, symptoms, or even an image of your thorax. So I would say you need to be very smart. We are investing a lot in our health system right now, and we need to make strategic investments for strategic sectors. Let me give you one example. In a country such as Paraguay or Ecuador, the importance of tourism is not as high as in the Dominican Republic. They have other economic activities, mining, for example, in the case of Ecuador. But in the Dominican Republic, tourism is a big deal. So we need to invest in improving the airport capacity to handle this situation. Just to give you an example, using our limited resources, we need to make sure that in our main airports, we have a PCR machine that can test all the travelers that enter the country and say, you are safe, you can enjoy your vacation, go to your hotel. We've tested all of you, we've tested all the workers in the health, in the tourism sector, in your hotel, so enjoy. Okay, but we have 10 travelers, you are infected, so let's have a COVID hospitals, I'm sorry, COVID hotels, for example. That strategy cost, of course, but is a strategic investment, because what tourism represent and all the linkages with the rest of the economy deserve that investment. Whereas if you are in other countries, that investment would not be a priority. So I'd say that 2020, investing a lot in the health sector, sustaining consumption. Consumption is about 70% of our GDP, and helping SMEs. Helping SMEs survive. Whereas in 2020, we need to discuss a lot helping SMEs to produce more and employ more people.
Generate employment, yes.
And I mean, probably 2020 is health and avoiding a sudden reduction in economic activity, whereas 2020 is going to be more related to the kickoff of the economy.
Okay. So, Minister, we just have a few minutes left. I want you to talk a little bit about the plan to reopening. I mean, I know that there were some announcements last night, and can you walk us through what is the plan in the next few weeks on how is the Dominican Republic going to start to reopening?
Of course, and
some of the sectors and industries.
Of course, and I would like to combine that with a question of our key performance indicators or internal limits. Of course, we track the number of beds in hospitals that are separated for COVID treatment, and we track the number of ICUs and ventilators that can be used for COVID. And that's very important because, you still have all the other health problems in your population. You have cardiovascular problems, you have other respiratory problems, you have other viruses at the same time. So you still have a demand that's going on for your health sector. So we do have our KPIs defined, number of beds available, number of ICUs and ventilators available.
And that's those are the metrics that you're going to keep looking at while you reopen the economy, right?
Yes.
Those are the, okay.
Yes, but not only what's going on right now, but also the forecast. We have different models. We have the SEER, the SAIR, the Systrom model, the case fatality ratio model, and we forecast what's going to happen, or we think it's going to happen in the future, and we see if we can handle that. We see if we need to increase the purchases of the health sector, or if we need to strengthen the social distancing measures. So last night, President Medina announced what we call the intelligent social distancing, in which we are going to gradually allow a higher number of workers, but still keeping restrictions in social activities. So we still have a curfew, we still have limit to free association and free agglomeration of people. No, what we want is allow people to go to work, return to their houses, and limit their interaction to the family and the labor. Still very limited to what they can do in social spaces. So we are, in about 2 days, we are going to allow all the sectors that do not imply agglomeration of people. And by that, we mean commerce, construction, well, mining was already open, certain industries, call centers, with a limited amount of workers. With protocols that we have designed for each sector and general protocols that we prepared with the CDC guidelines, and we're going to see what happens, and we're going to see what the different models forecast in the future, and in about 2 weeks we decide if we allow an even higher percentage of workers for each sector. And we are allowing a higher percentage in micro and small companies, because those are the ones that are most affected.
Vulnerable.
Exactly. Yeah. So we are prioritizing micro and small companies. Just to give you an example, we are allowing 50% of the payroll in micro companies, but only 25% in medium and large companies. In about 2 weeks, we might increase that, let's say to 100% of employees in micro companies, 50% of employees in medium and large companies, and increase up to the point that we think we can handle the entire payroll of the private sector interacting in the country. We also combine that with restrictions to the time at which they can start operations, because we need to control the amount of people that we have in public transportation. We are limiting to 30% of the capacity in metro and buses, for example. So we have a part of the economy that is going to start working at 7 p.m., another 8 p.m., I'm sorry, a.m., 7 a.m., 8 a.m., 9 a.m. And we are promoting that all the administrative stuff, they still can work from home. Also,
Minister, we have very little time, so Instagram is gonna kick us out in a minute and 10 seconds. So I wanna just take 10 seconds and then give you the last word by saying, you know, we're very proud of having policymakers like you that think long-term and are there to bring solutions. So this has been really insightful. But I wanna ask you in the last 30 seconds, and sorry we have to cut it abruptly, but I didn't know Instagram will gonna cut off us. What have you learned on a personal level? How has this changed you for the future?
Policymakers need to be humble. We still don't know quite many things. We have to listen to different sectors because each one has a limited part of reality and truth, and that we need to work together. We need to work together inside the government with the private sector, but also different countries can handle this situation if they cooperate competing. So being humble, learn every day, and cooperating with each other.
Minister, thank you so much. I think we're saying bye on Instagram. We have a couple more minutes or one more second here on our Twitter followers. I really want to thank you for the time. I know that you're super busy. It's been very hard days for you. I'm sure you haven't slept a lot, and you are doing all, I know you personally, I know that you're doing this for the sake of your people and your country. So I want to thank you as a citizen of the world for doing this such hard work and having the time to teach us this lesson. So thank you so much. And thank you everybody for joining. And we'll announce soon who's going to be our next guest. Thank you.
Thank you very much, Dany, and thanks everyone for listening.